Very good morning, everyone. I'm Dr. Tushar Pandey. So today's topic is types of pulses. We'll be quickly going through these important topics for exams. Now, pulses parvus et tardus. It's known as a low amplitude pulse with a slow rise. Where do you see it? In a severe valvular aortic stenosis. Then we come to a pulses bispherians or a bispherians pulse. Basically, in bispherians pulse, we have two systolic peaks. As you can see in this image, it's a S1 and S2. In S1, you have that is systole, you have two peaks. And where do you see them? You see aortic regurgitation with aortic stenosis or hypertrophic obstructive cardiomyopathy (HOCM). Then you have dicrotic pulse. Now in dicrotic pulse, you also again have two peaks, but in bispherians you had two peaks in systole, while in dicrotic pulse you have two peaks, but one is in systole S1 and other is in diastole S2. So this is known as a dicrotic pulse. And where do you see it? D for dicrotic, D for dilated cardiomyopathy. Remember. Then, moving to pulses alternans. Basically, it's a regular alteration of the amplitude in a normal regular rhythm that you see, and you see it in a severe left ventricular failure. Okay, pulses alternans. Then pulses bigeminus. Pulses bigeminus is presence of a premature beat following each regular beat. And where do you see it? At digoxin therapy. In digoxin therapy, you see a premature beat following each regular beat, known as pulses bigeminus. Then pulses paradoxus. Pulses paradoxus refers to the phenomenon in which there is decrease in the systolic arterial pressure by more than 10 millimeters of mercury during the phase of inspiration. Okay. Then where do you see a pulses paradoxus? It's very important. You see in pericardial tamponade. You see in severe COPDs, in superior vena cava obstructions, bronchial asthmas, constrictive pericarditis, pulmonary embolism, and hypovolemic shocks. In water hammer pulse, also known as Corrigan's pulse or collapsing pulse. Basically, it is nothing, as you can see in this image, a rapid upstroke followed by a rapid descent. So this is here what is a normal pulse, and this is a water hammer pulse. So as compared to the normal pulse, there is a rapid upstroke followed by a rapid descent. This is what is known as a collapsing or a water hammer or a Corrigan's pulse. Where do you see it? In aortic regurgitation, patent ductus arteriosus, AV fistulas, pregnancy, beriberi, and hyperthyroidism. Remember these conditions. Then finally, we have an irregular pulse. We see it in atrial fibrillation. Okay? Thank you so much. That's enough for today.